So my last question is then, how has technology or materials, since you've been in this industry for so long, changed how you've seen doctors approach socket preservation over the last few years?
I mean, really what I've seen is a change in general dentists, general practitioners. They're just keeping more things in house. And I think that most of the specialists are okay with the socket preservation being done by the general dentist.
Right.
They will actually work to help them in doing that procedure and kind of keeping that revenue in house. Um, some specialists even will assist with the very simple implant procedures that are just single sites. They're not in the aesthetic zone, but what they want is they really want to get a base of referrals for the more complex procedures, the full on, the all on four, the full arch procedures. So I think what we've seen is kind of more collaboration with specialists and general dentists on just doing socket preservation and then kind of delineating the workflow to, general dentists place implants now, but for the complex cases, sinus lifts, putting implants into the maxilla, doing full arch, then there's a comfort level where, the general dentist, general practitioner says, hey, I'm comfortable referring to Dr. So and so. They handle this, teeth in a day or whatever, and there's a better workflow. Um, and I see basically, more patients are getting implants, hence we're seeing more socket preservation procedures done, and we're
Mhm.
seeing less edentulous loss in the market. And as far as materials have gone, I think the big development has really just been, the advent of these bone plugs for socket preservation. The fact that
Right.
we've been able to create this, that's an easy, cost-effective way of doing this procedure. Maybe you can't place the implant as fast,
Hmm.
but it's opened up this procedure to a lot more clinicians that
Hmm.
can do it. So, and I think that that's a good thing. But again, I think this podcast is good because, you can decide, again, what is important to my patient? Is it speed? Is it just doing, the socket preservation procedure? They're 50-50 on the implant. Maybe they'll come back in a year and get it. Maybe they won't, but they'll have that bone there ready if they do decide to do it.
Yeah. The
So
foundation's built.
the foundation as well is a great term for it. I always talk about that. We always talk about the house, right? The house is
Yeah.
the implant. Everybody wants to talk
Mhm.
about the house. Nobody talks about the foundation, and the foundation is as important or even more so than the house. You
Absolutely.
right? You can have the best house in the world. If the foundation is cracked, you're gonna have problems.
You're gonna have problems. Absolutely. Absolutely.